Hello everyone, this is Dr. Naomi Sonatis with the Nurse Maker. This is a follow-up video to the video previously seen where we went over diuretics. So now we're going to go over 3 questions to see if you know what they are, if you learned anything from the last video. I'm hoping you have. All right, so question number 1. A patient is brought to the emergency department with shortness of breath, a respiratory rate of 30 breaths per minute, intercostal retractions, and frothy pink sputum. The nurse caring for this patient will expect to administer which drug? So which drug are we going to give in this situation? We have mannitol, we have hydrochlorothiazide, we have furosemide, and we have spironolactone. What do you think is the best choice? All right, hopefully you came up with a decision. The correct answer is furosemide. Okay, all of these drugs here are diuretics, but you must remember mannitol we do not use for a patient who has we do not use for a patient who has edema or heart failure, congestive heart failure, or any heart problems or respiratory problems. We use mannitol for ICP or IOP, increased intracranial pressure or increased intraocular pressure. That's why we would use mannitol. Now, hydrochlorothiazide, some of you may have thought hydrochlorothiazide, while that is a good choice, it is not the best choice. Hydrochlorothiazide is one of the first line of medications we use for diuretics when you are stable. If you are not stable, we need a diuretic that is going to work now, quick, okay? So furosemide, Lasix, is the drug of choice, and we can give that to you IV. Remember, I told you if we give it to you IV, this patient is in the ER, give it slowly, don't push it quickly, because it can cause ototoxicity. So we don't want that to happen. And spironolactone, it is a case-sparing diuretic. It is a diuretic that we use as an add-on. So it's not usually one of the first-line drugs. But remember, in an emergency situation, we want to use our loop diuretic because they work really quick and they're great in emergency situations. So number 3 is the correct answer. And we have the rationale right there for you if you would like to read over that. So the next question that we're going to go over, a patient is prescribed digoxin and furosemide. It is most important for the nurse to assess which value before administering these medications. So we have the serum sodium, blood urea nitrogen, serum potassium, or plasma B natriuretic peptide. All right, so hopefully you guys remember I told you whenever we're giving a diuretic, we must monitor your electrolytes, specifically your potassium, okay? And like I told you before, when you are taking furosemide, your potassium level will go low, which is called hypokalemia. And if you're on digoxin and you have low potassium, that can lead to dig toxicity. So you would want to make sure you monitor the patient's potassium before you give the medication. Okay, so choice number 3 is the correct answer. All right, so this last question says a patient who is taking Lasix knows that he should increase the intake of what food? So if you remember what we talked about in the previous slide, Lasix, also known as furosemide, is a diuretic that lowers your potassium. So we need to pick a food that has high potassium. So we have option A, avocado, B, iceberg lettuce, C, plums, and D, apples. So which one of these have the highest level of potassium in them? I hope you all said A. Avocado has the most potassium here. So this is what we would give to someone who is taking a medication that is lowering their potassium. Because remember, like I said, we want to make sure that your potassium level stays within range, which is 3.5 to 5.0. So the correct answer again is A. All right, everyone. I hope this has helped you with understanding the mini lecture on diuretics. All right, stay tuned and take care. Bye-bye.